Hi, I'm Peter Rooney. In 2006, I lost my father to renal disease. He was on the waiting list for a new kidney, but did not receive one in time. Unfortunately, so many like my father have lost their lives while waiting for a life-saving organ. At New Jersey Sharing Network, we're committed to saving and enhancing people's lives through organ and tissue donation and by informing people about this important decision. Because you can make a difference and save a life.
Funding for this edition of One-on-One with Steve Adubato has been provided by the Russell Berry Foundation, Caldwell College, the Fidelco Group, Fedway Associates, New Jersey Sharing Network, dedicated to saving lives through organ and tissue donation, Kessler Foundation, changing the lives of people with disabilities, and by the Healthcare Foundation of New Jersey, founded by the Jewish community. Promotional support provided by The Star Ledger, powering NJ.com, and by Commerce Magazine.
This is One-on-One.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
People like laughing at others, so I don't mind if the other is me.
You see, you go right into the character. That's what it is.
I'm bringing families together a half an hour each week. Man, I'm doing something special.
And so I do feel successful.
Welcome to One-on-One. I'm Steve Adubato. For the first time, and not for the last, we have here on the set of One-on-One Joe Berardo, who is the President and Chief Executive Officer of an organization called MagnaCare.
Yes, sir.
Good to see you. What is MagnaCare?
MagnaCare is a health plan, statewide, New York and New Jersey. We serve, we just broke 1 million members, actually, this past January.
How hard is that?
It took, the company's 24 years old, so it's taken all of 24 years to get that big. And we operate basically in the middle market, so we serve employers that tend to be, maybe 25 employees and larger. Although we have a couple of partners on the exchange, so we've actually branched into the individuals and small group.
It's interesting. By the way, you just told me before we got on the air that you're partners with one of our partners, Make-A-Wish Foundation.
I am.
We'll go back to MagnaCare in a second, but tell me that, because we have Tom Weatherall, who's actually coming in, who's the executive director. He's actually coming in, right, with tomorrow's coming in. We're taping with one of the Make-A-Wish kids who are fabulous. How did you get hooked up with them? I promise we'll do MagnaCare, but how did you get hooked up with them?
Actually, through Tom. So Tom and I met socially.
Funny how New Jersey has like 8 people who
really
are friends with each other. Go ahead.
So Tom and I met through some friends in Monmouth County. So I spent about 3 years just supporting various events, and about 3 years ago I got asked to participate on the board. And so I served on the board of directors, and actually in September I took over as chairman of the board. We're working with Tom
What do you
regularly.
love about them?
It's funny, I'm glad you asked that, because while I love the fact that we do wonderful things for kids, I do it for the parents. I couldn't imagine, I have 4 healthy children, I can't imagine what these parents go through as they face these illnesses and these challenges with their children. So while you watch the reaction of a child, going to the Super Bowl or going to Disney World.
By the way, sorry, Joe, we should make it clear. Make-A-Wish grants wishes to children who are dealing with some pretty serious illnesses.
Yeah, life-threatening
I'm sorry,
illness.
I don't want to assume people know that, so go ahead, I'm sorry.
Yeah, so it's a life-threatening illness facing a child. And what I love about it is that you see the amazement of the child, but when you see the relief of the parent and the happiness of the parent because their child just smiled for the first time, in a year, it's really, really rewarding.
It's good stuff. The healthcare, I'm sorry, gotta go back.
Okay. That's all right.
Healthcare environment, post-implementation of Obamacare, ACA, the Affordable Care Act. Question. How challenging is this environment, not just for an organization like yours, but more importantly for consumers?
Well, it's completely confusing. It's very disruptive on all accounts, whether you're a consumer, whether you're somebody like me running a company that serves businesses, whether you're a provider, and I know you've got all those constituents that either participate in the show or watch.
Sure.
On the consumer side of it, I think what's really frustrating is they don't exactly know where to go, what plan they should choose, what are the rules. I also feel like going into January 1st, because of the news, everybody felt rushed, that they had to make a decision by January 1st, when they really had till the end of March to make decisions as individuals, and the small group exchanges is postponed a year. But I think what I tell everybody is sit back, ask questions, go to the websites, meet with the navigators, try to understand what your family used in the last few years as far as healthcare goes, and then make decisions. If you're an employer, again, most of the things that can impact you from a fine or a regulatory perspective have been pushed off a year. So, take this time to make sure you really understand, what are you required to do. Things like that are, if you're an employer of 50 employees or more, you have to offer insurance. So people are saying, should I fire somebody and be 49 employees? Should I not hire the 50th employee?
And if I go with the 50, does that mean I don't give bonuses, or do I not give raises, do I not expand?
Exactly.
Tough choices.
It's really tough choices. Here's what I would say: run your business. Run your business to run your business. I think a lot of this is math. If you're a business owner and you have low-paid workers who could benefit from subsidies, you're probably going to do them a favor if you sit down and really evaluate what you're offering and who your employee base is, because some of them can really benefit by going to the exchange. Now, others at the same time, may not. So they're going to be reliant on employer-based coverage. So I really think there's no one-size-fits-all in this at all. People really need to understand their current situation.
Let me do this. If you were in charge and you were making these decisions pre-implementation of Obamacare,
You mean like I pretend I do when I walk around my house? Yeah.
Does anyone listen?
I think, no.
What would you have done?
I think it would have been as simple as expanding Medicaid and expanding Medicare.
Explain that to folks who aren't experts on the policy side. You would say it again?
I would have expanded Medicaid by basically, we're doing some of that in the law by expanding the income level. We're doing some of it. So expand the income level that makes people eligible. So you can make a little bit more money and be eligible.
And still be
for Medicaid.
eligible.
Still be eligible. Medicare, I would have brought the age down. So rather than have a system where we just created all this complexity and all this bureaucracy and all this disruption, bring the Medicare age down, I don't know, let's call it 55, and let people buy in.
And what is it now?
It's 60, 65 or 67.
Bring it down, you say.
Bring it down. Bring it down.
How would that have helped, Joe?
Well, what's interesting about all this is the government programs dictate pricing. If you participate in Medicare or Medicaid as a provider, as a doctor,
Medicare
hospital,
for folks who are older,
right.
Medicaid for those who are financially in need.
Yes. If you participate as a doctor in a hospital in those programs, the government dictates the pricing. So there's a Medicare rate. You've heard this, there's always these...
The reimbursement.
Reimbursement to the providers. And same thing in Medicaid. It's basically a state / federal program in Medicaid, and it's a federal program in Medicare. So right away, you have the federal government saying this is what the reimbursement levels are going to be, which in many ways are more cost effective than what the commercial marketplace is. Almost always, really. So now you would have been basing a health plan off the most cost effective reimbursements in the marketplace, which clearly would have had impact on the cost. And then secondarily, you've heard a lot about accountable care organizations, ACOs, all the integration of care. That's happening mostly in the Medicare environment right now. The government pays
with older
people,
caring for older patients.
Right. So if you're going to implement those efficiencies and you're going to invest the dollars in that, I would have just had it reach down further into the population.
I got to ask you something. Say someone was trying to follow what you were saying, as I was and as our audience is, and they said, you know what? Some of it makes sense, but I'm confused a bit. Can you understand folks being confused, A, and B, how the heck are we going to better educate folks so they can get a better grasp on this, Joe, so that they can make the best decisions for themselves and their families? It's confusing.
It's completely confusing. Steve, that's the challenge, and the challenge is, I don't know that it's going to take, I think it's going to take rather 5 years or so for this to really, really settle down. You have a lot of new entrants to the marketplace. In New Jersey here we have a co-op, Health Republic.
Yep, they just jumped in.
Yep, you got some major
players.
Full
disclosure, they just jumped in as an underwriter of ours to do health education. I just want to make that clear. Once you said that, I felt the need to say that.
Great initiative. Not-for-profit healthcare. I think in the state you also have Horizon and AmeriHealth participating in the exchanges. Both good companies. But I think that the challenge that we have is that we're talking about introducing new products, right? So there's narrower networks, there's subsets of networks being offered to people. I don't think people really understand that completely.
They're confused.
Right? And also you don't know whether you're going to get a subsidy or not. Am I eligible and should I join because it's going to be paid for by the government or 80% by the government? So I think it's going to take, at least this next year for people to understand some of the mistakes they might have made by joining or not joining. And then it's going to take 2-3 years beyond that for the system
Final
to settle
question:
down.
the role of the media in all this?
It's sound bites. It's disappointing.
But okay, that's what's happening there.
Yeah.
What do you think those of us who want to think that we're part of the solution in terms of, I don't want to make public television sound like we're the panacea, but for those of us who aren't doing sound bites but rather full discussion, what can we do?
I think it's continue to share facts and tell people they don't need to rush or panic. Really take the time. We spend more time figuring out what television we're going to buy versus what health insurance plan. There's 50 sites you can go on to figure out what car to buy and what price is right.
And which one's more important in our lives.
Yeah, you can't get your health back.
Yeah. Joe Berardo is the President and Chief Executive Officer of MagnaCare, and we appreciate you being with us. And given the complexity of this most important topic, I'm sure it won't be the last time you join us. Thanks, Joe.
My pleasure. Thanks for having me.
This is One-on-One, important stuff here. Stay tuned, we'll be right back.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org. Visit us online at oneonone.org. Find us on Facebook at facebook.com/Steve Adubato, PhD, and follow us on Twitter at Steve Adubato.
Jane Hanson is Executive Director of Partners for Women and Justice. Good to see you, Jane.
Nice to see you, Steve.
Jane, we've talked before about this very important topic, dealing with domestic violence. Let folks know what your organization does and why it's so important.
Well, it's a not-for-profit public interest law firm, and we provide free legal assistance to women who are experiencing domestic violence and are attempting to escape those situations. And it's important because without having a lawyer represent them in court, or without having a lawyer to advise them before they go into court on their own, they really don't know what the reliefs are that they can get under New Jersey law. And New Jersey has a very, very strong law against domestic violence.
Yeah, we partnered up and we met each other through the Russ and Angelica Berry Foundation.
Yes.
You won the Russ Berry Award for Making a Difference in 2009.
That's right.
And we recently, actually we were doing some coaching and training with folks who have won that award and others in the nonprofit community in terms of their leadership and communication skills, and we're featuring some of those folks here. And it's so fascinating to me because those awards for making a difference. What difference do you really feel that you and your colleagues are making for these women and their children who have suffered so much that most of us cannot even comprehend?
Yeah, the difference is peace and safety, physical safety.
Give us a for instance.
Well, we had a client who was pregnant and with twins, and the father of the children did not want her to have those, the children, and he set her up to be assaulted, and she was assaulted and was taken to the hospital, and it was actually here in Patterson. And
where we're taping?
Yeah.
What do you mean he set her up to be assaulted?
Asked her to go with him to a movie, and parked in an isolated section of the parking lot, and they were attacked, quote unquote, attacked. But she was the only one who was attacked, and viciously attacked. And it was clear from what was happening to her physically that they were attempting to abort the children. And they were not successful. She was in a coma for several days. And when she came out of the coma, the hospital personnel put her in touch with us, and we were able to get a restraining order against this individual for her. Her children were born healthy, but like clockwork, every year, the father files a motion for a reduction in child support and for custody.
And your organization, I mean, given the emotional, the psychological, the so many unimaginable areas where these women, these children suffer, ways in which they suffer, talk to folks about the legal challenges and battles and difficulties they face and how you help them. Because I immediately think the restraining order, but it's not just that.
No, it isn't. It's much more than that, and that's what's so important about New Jersey and New Jersey's law.
For instance?
In the first instance, the restraining order, when it's final, is indefinite. In many other jurisdictions, it only lasts for a certain period of time, and then the individual has to go back into court and prove that it's still necessary. We don't have that in New Jersey. The other thing that can happen in the course of obtaining a restraining order is that issues such as safe visitation arrangements and custody and child support, and if there are any damages, like medical expenses that the victim incurred or damage to her house, those can be obtained in the course of a restraining order. The reason why it's so important to know what your rights are before you go in.
And most of these women do not.
No, they don't, and there are many misconceptions out there, and abusers sometimes use that against them. One of the things that we see is a threat to take children away.
Hold on, I want to be clear. Some of these abusers not only are physically, mentally, and emotionally abusive, they will attempt to manipulate misinformation about the legal system and say, if you do this to one of these women who are on the end of being abused, if you do this or don't do that, I will get the children. I'm just saying that.
Yes,
which is just not true very often.
It's not true, and they may not know whether it's true or not. But
the woman.
It's or the man.
Or the man, go ahead.
But it's a threat that is a very common threat. Children are often used as pawns in these situations. I mean, you only have to open up the paper to read about children who are murdered because a woman, their mother, wanted to leave an abusive relationship. It's not uncommon. And domestic violence is, there's a lot of physical abuse associated with it, but it doesn't have to be physical. And the real theme in it is control, wanting to control another person's life, wanting to control the relationship with that person, not wanting that person to have a life of her own or make decisions on her own. And that's really what it's about. And so the ultimate control is taking children.
For the rest of us, Jane, who will often read about these cases too late, after the fact, when something horrific has happened. A woman, and even worse, her children have been killed. And we say, if only we had known, if only we could have, should have done something. What should we do? And I know it's case by case, and I know that's an unfair question in so many ways, but is there anything we can do other than contribute to an organization like yours, which helps support the work you're doing? Which, by the way, let's put up the website. I know Jackie Cook, our great producer, I know you'll have it up right now as we speak. By the way, where does that money go?
It goes to legal services for victims of domestic violence.
Do your lawyers get paid?
No.
Pro
I mean,
bono?
our staff attorneys get paid, but the pro bono attorneys in private practice don't get paid for taking our cases.
Do the legal firm, the law firm say, hey, take some time to do this?
Yes, many of them are very supportive. The major law firms in the state are very supportive of our program.
Okay, I'll go back to my question. What else can we do?
I think that you need to be open to the possibility that abuse is going on. It happens across all ethnic groups, all economic groups, and just be there to support the individual and know that there are resources available. You can call 911 for police intervention. There's a domestic violence hotline nationwide that victims can call, and they'll be put in touch with local services.
Jane, do we push, because a lot of times these women are not confident that their confidence will be kept, the confidentiality. Do we attempt to push them in this direction to call your folks?
It's their decision ultimately. I think that
encourage?
I think what you can do is give them information and explain to them that there are resources out there that can help them, that can make a difference to them and their children, help them escape this abusive relationship, and they should at least talk to people about it. It's their decision ultimately, whether they flee and go into a shelter, whether they seek a restraining order, but they have to have the information to know what the right decision for them is, and it varies from individual to individual.
You just imagine the horrific and unimaginable abuse that these women, these children go through, but then to have the legal system not work on your behalf, it's hard to comprehend. So that the fact that your organization is doing this and trying to reach out as best you can is important. So Jackie, one more time, could we put up the website for any woman or anyone who knows a woman who you think needs help? Give that information out. Jane Hanson, Executive Director, Partners for Women in Justice. Please keep up the work you're doing and keep making a difference because the Berry Foundation did the right thing in recognizing you and your team. Thank you.
Well, thank you. Thank you for having me.
We'll be right back right after this.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org. Visit us online at oneonone.org. Find us on Facebook at facebook.com/Steve Adubato, PhD, and follow us on Twitter at Steve Adubato.
Dr. Michael Harris is co-director of the Institute for Pediatric Cancer and Blood Disorders at the Joseph M. Sanzari Children's Hospital. Good to see you.
Thanks for having me, Steve.
When a child has cancer, what happens? How challenging for you and your colleagues, but more importantly for that child and his or her family?
I think one of the most difficult days I have on any given day would be when I have to tell a parent that his or her child has cancer, because the whole world is altered. And I remember once very clearly, I was speaking in this tone of voice to a parent, and she said, "Stop shouting at me." And I realized immediately that my words increased hundreds of decibels because I was telling them that their child had cancer. So it is a very difficult day. However, at the same time, we know that we cure more than 80% of children with cancer. So although cancer remains the leading cause of death outside of accidents for children up to the age of 19, we certainly cure many more children than we used to. But yet, when one child dies, a whole universe is destroyed. So we have a tremendous responsibility to try to cure that child and to use the most cutting-edge therapy to get that child to be able to live and live a very fruitful life.
Doctor, let me ask you this. There are so many different forms of cancer. What are, if I can ask it this way, and if it's the wrong question, you'll tell me, are there certain forms of cancer that are more likely to affect children than others?
Excellent question. Children have a different category, if you will, of cancers that affect them than adults. Adults get cancers of linings, you know, the GI tract, the breast, etc. Children get cancers that affect more or less the soft tissues, such as sarcomas, such as muscles, or the tissues that surround the muscles, the brain, which is the most common solid tumor in childhood, and the most common cancer we see are the leukemias, acute lymphocytic leukemia, followed by acute myelocytic leukemia.
What does that mean?
So the lymphocyte is a cell in the bloodstream that can become cancerous, and the myeloid cell are the neutrophils that help fight infection. That's a different type of cancer. So but leukemia, of course, is a cancer of the bloodstream or the cancer of the bone marrow, where the cells are made. And that, by far, is the most common type of cancers we see. It makes up about 40% of our cancers.
The most treatable forms of cancer, pediatric related cancer, are?
Well, the first are the leukemias, especially acute lymphocytic leukemia, which is that one category of leukemia where we cure over 80%, probably close to 90% of those children are now cured. Tumors of the kidney, such as Wilms tumor, we cure the overwhelming majority of those children. Hodgkin's lymphoma, non-Hodgkin's lymphoma, we cure the overwhelming majority of children. The most difficult cancers that we have to cure are the brain tumors and tumors of what we call the parasympathetic nervous system, which are neuroblastomas. Those are very difficult to cure, but we continue to increase our cure rate. So as time goes on, we hope to be able to cure more and more children like
Doctor,
that.
you told our producers in a pre-interview that you really cannot simply treat the child when it comes to pediatric oncology, that you must treat the entire family. And not exactly sure what that means.
As I said in the beginning, when cancer hits, the whole family mechanism is uprooted.
But how do you treat the whole family?
So how we treat the whole family is by having a very strong psychosocial support system. So we have social workers, we have child life who deal not only with the children and get into their hearts and minds, but also deal with their siblings. We have a psychologist, neuropsychologists who are able to evaluate what we are doing to the children.
But you can't,
and get these children through
you
that.
can't force the family to do it, but do you encourage them by letting them understand that even if they don't understand or initially say they don't want it, that it is essential?
That is a fantastic question, and thank you for asking that.
Because they may resist. I don't know.
You're absolutely correct. Some families will resist. They say, we can do this. We don't need to be here. After all, we're very strong. We're a strong family.
Do they have any idea what they're going to face?
That's right. So those families we monitor very carefully, and when the time is right, we then introduce our social workers, our child life people. They're introduced on day one, but then they may push them away. But they're always there to be able to step in. And very often, those families, and they're the minority, the majority willingly accept the support systems that we're going to give them. But those children who come from families where they resist, we wait, and the majority of those families finally come around and accept our services.
There's something called Cure and Beyond. Give me 30 seconds on it. What is it?
Cure and Beyond is our program for childhood cancer survivors. It includes not only the children, but I must admit, adolescent and young adults. The oldest person I am seeing now, child, is now 50, 51, too.
Right.
We call them the boys. They come every year. So it's a program that deals with the long-term effects of cancer therapy and the cancer itself. So we monitor these individuals, and we're not internists. Please understand that. What we do is we basically become the captain of the ship that finds the right services for these individuals who are suffering from long-term consequences of the cancer.
30 seconds. As challenging as your work is, very rewarding?
Extremely rewarding. Even when a child dies, which is a tragic situation, it certainly has affected me over the years. Just ask my wife and she'll tell you how it has affected me. But we gain so much from these individuals. And those children who are cured, they keep on coming back to us, and I see their families, I see their children. That is fantastic.
Doctor, I want to thank you not just for being here, but much more importantly for the work you do every day. Thank you.
Thank you ever so much, Steve.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Russell Berry Foundation, Caldwell College, the Fidelco Group, Fedway Associates, New Jersey Sharing Network, Kessler Foundation, and by the Healthcare Foundation of New Jersey, founded by the Jewish community. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.